Today we have just one new confirmed case of COVID-19 to report, and there are 4 new probable cases. All of those cases today can be traced to a known source. 3 are linked to the St Margaret's Hospital and Rest Home cluster in Auckland, and 2 are linked to other known cases. In the context of our overall total, 6 cases which were previously probable have been reclassified as either still under investigation or not a case. So this means our current national total is now 1,469, and that's a net reduction of 1. The total confirmed cases is 1,122. This is the number we report to the World Health Organization, and it is also the number that many countries report publicly as their total number of cases. For example, Australia. So this number at the moment, 1,122, is the number that is comparable to those of other jurisdictions, including Australia. The reason why some of those probable cases have been reclassified is because public health units are working with us to review recent probable cases. Some of these, for example, have been classified as probable cases as part of a precautionary approach around clusters or existing cases, particularly over this last few weeks. This means then we identify close contacts and we put them in self-isolation while they are being investigated. We've found then in going back and reviewing those cases, especially in some instances where they have repeated negative tests, that they no longer should be classified as probable cases, and we will continue to do that over these next few weeks to help get a really good picture of what our total case number is. We will continue to report each day the number of confirmed and new probable cases and the net total. Yesterday there were 2,939 laboratory tests processed. Our combined total to date is 123,920, and the lower number of tests yesterday, as you all know, fits the pattern we do see on weekends. Of our cases, 1,180 are reported as recovered, an increase of 38 on yesterday, and this means around 80% of our cases are now recovered. Today there are 7 people in hospital, again unchanged from yesterday, and this includes 1 person in intensive care in Middlemore. Very sadly, we have 1 additional death to report today, which takes our total number of deaths related to COVID-19 to 19. A woman in her 90s who was a resident at St Margaret's Hospital and Rest Home died yesterday in Waitakere Hospital. Our thoughts are obviously with her family at this very sad time. This woman was a confirmed case of COVID-19 and had a number of underlying health conditions. She was one of a group of residents transferred to Waitakere Hospital earlier in the month and is the 3rd person from that cluster to have died. Her family have expressed their gratitude to the Waitakere Hospital staff who cared for their loved one. There are still 16 significant clusters, and again, this is no change from yesterday. We have only 1 case since the 1st of April where we are still investigating the source of infection. This is a confirmed case in Tauranga, and a possible link is still being investigated. A second case that was in Waikato that we had reported on in the last few days is now no longer considered a case. That person was a probable case, but following further investigation is no longer classified as such. Just a note on how we manage cases and close contacts under Alert Level 3. There will be ongoing strict isolation and monitoring around all confirmed and probable cases. All confirmed and probable cases will continue to be managed in quarantine or managed self-isolation if they are recent arrivals into New Zealand, or will be under strict self-isolation and active management if already in New Zealand. Active management of cases and self-isolation means there are daily phone calls to check on the health and welfare needs of people, including any symptoms they may have. And likewise, the same process happens with all close contacts. Daily contact is made to ensure they are undertaking the mandatory self-isolation for 14 days to check on symptoms and indeed any welfare needs they have. A new Health Act order comes into effect from 11:59 tonight when New Zealand moves to Alert Level 3. This new Section 71 notice under the Health Act is available on the Ministry of Health website and contains very detailed information about the constraints on activity under Alert Level 3 and also how permissions are granted for certain activities. And finally, just a reminder to people who have any health needs, and in particular those that are not related to COVID-19, please do not delay seeking care from your GP or through the Healthline number 0800 611 116. That is the regular Healthline number. And as usual, if it is an emergency, please do call 111. And if you get an appointment from your District Health Board in coming days for an investigation or to go in for treatment, please do take up that invitation. We can assure you that hospitals will be operating with everyone's safety in mind, including those of patients, families and, of course, staff. Thank you, Prime Minister.
Thank you, Dr Bloomfield. We are now 11 hours away from the lifting of Level 4 and of the strictest constraints placed on New Zealanders in modern history. It's been nearly 5 weeks living and working in ways that just 2 months ago would have seemed impossible. But we did, and we have done it together. Let me run through a few of the numbers that show how far we've come, the figures that we've been working towards in order to be able to confidently move to Level 3. Our testing has grown from obviously zero pre-COVID-19 to the capacity to process up to 8,000 tests per day. That's resulted in us having one of the highest testing rates in the world per capita. We have a very low percentage coming back positive each day, as low as 0.05% last week and only 0.17% today. This provides strong evidence that there is not widespread transmission that is going undetected. The virus has a transmission rate of around 2.5 in most places without controls. Under lockdown, this has dropped to 0.4, less than half a person infected by each individual. And for the last few days, our cases have been in the single digits, with, as you will have heard from Dr Bloomfield today, just one confirmed case. It is worth pausing to digest those numbers. They are incredible, and they are thanks to the sacrifices that every single New Zealander has made. As we entered Level 4, modelling from Professor Sean Hendy gave us insights into a scenario in which we did not lock down. And in that scenario, our steady case numbers seeded an epidemic that potentially would have seen a period of as many as 1,000 cases per day. We will never know what would have actually have happened without our Level 4 restrictions, but we can look overseas and see that this devastating scenario has played out in many other countries. Through our cumulative actions, we have avoided the worst. Tragically, what we have been unable to stop is the loss of 19 New Zealanders to COVID-19. Numbers, of course, mean nothing to their family and loved ones, and nothing can take away their grief. All I can do or say again to those people is that our thoughts and sympathies are with you. We send them our love in their time of loss. As we do to anyone who has lost someone during lockdown and may have been unable to be with them or to farewell them as they would have wished. This has been one of, I think, the hardest elements of Level 4. Of course, the ambition we all have is to confidently reach the position where we can bring back the social contact that we all miss. But to do it confidently, we need to move slowly and we need to move cautiously. We must make sure that we do not let the virus run away on us again and cause a new wave of cases and deaths. To succeed, we must hunt down the last few cases of the virus. This is like looking for a needle in a haystack, and we need your help to finish the job we have started. There is no widespread undetected community transmission in New Zealand. We have won that battle, but we must remain vigilant if we're to keep it that way. That includes safely returning more New Zealanders to work, enabling more businesses to reopen, and allowing some of the recreational activities we've missed in the past 4 weeks. As you will have heard me say repeatedly, it is not and cannot be a return to pre-COVID-19 life. That day will come, but it is not here yet. To get there, our team of 5 million needs to have zero tolerance for cases to complete our goal of eliminating the virus at Level 3. If you're unwell, stay home. If you have a runny nose, a sore throat, a cough, get a test. Let's make sure that we keep those testing rates up. We continue with our contact tracing and isolation. That's how we'll finish this job. As you know, we will be at level 3 for 2 weeks before Cabinet makes a further decision on next steps on Monday, the 11th of May. In order to consider a move to level 2, we'll consider the same factors we have for previous moves: continued extensive testing and what that's telling us, continuing with our rapid contact tracing, understanding exactly where each new case came from and how it connects to our existing cases, and confidence that we do not have undetected community transmission. I am optimistic that we can continue on a path of success, but let me be clear about 2 things. First, we can only do this if we all continue to pull together. And secondly, I will not risk the gains we've made in the health of New Zealanders, so if we need to remain at level 3, we will. Our priority, as it has been throughout these recent weeks, is the health of New Zealanders, because that's also the way that we can protect livelihoods. Of course, we've also put measures in place to cushion the economic impact by keeping as many New Zealanders in jobs as possible and by providing assistance to ensure as many Kiwi businesses as possible remain viable. We'll continue to do this, but I know what everyone wants is a return to the day when that is no longer required either. Before I conclude, a quick overview of how we'll be running the week ahead. Tomorrow, Cabinet meets from 10 a.m. The House sits Tuesday to Thursday from 2 till 6 p.m. with question time and other business, including a ministerial statement on Tuesday. Today will be the last day of the regular joint press conferences between myself and the Director General of Health. I know that many people around the country have regularly tuned in to receive information and advice during level 4. And so that's why I want to preserve my thanks for the day to Dr. Bloomfield. I consider New Zealand to be very lucky to have a public servant of Dr. Bloomfield's calibre leading the health response. His background in public health has meant I consider New Zealand to be amongst those countries who are lucky to have that expertise in leading our response, one that considers the health and well-being of New Zealanders in every respect. And so, Dr. Bloomfield, it's been a real honour. It won't be the last time you see us both up here, but the last of the regular times. And I thank the team that supports Dr. Bloomfield as well. From tomorrow, the Ministry of Health will continue their daily updates at 1 p.m. I'll return to my normal schedule of post-Cabinet press conferences and daily media stand-ups separately before the House. And most days there will be government announcements from this podium as we move through level 3 and increase our focus on the government's economic response to the virus. I anticipate at the time that we make announcements on whether or not we're moving from level 3 that again I'm likely to be joined by Dr. Bloomfield at that point. Finally, please remember the rules for level 3. And now that you have the opportunity, please, if you are taking part in a bit of contactless retail over the coming days, think about your local businesses. They need all our support.